let's get this straight. You had so much pain that you could not walk, you couldn't go up and down stairs, you couldn't bend or straighten your knee, so you got the surgery. Since you've gotten the surgery, you had so much pain that you couldn't walk, you can't go up and down stairs, you can't get up and down from a chair without any sort of pain. What happened? In this video, I'm going to show you some techniques that I would do if I were to get a total knee replacement and I was dealing with some lingering pain. Let's jump into it.
Let's get better with Brando.
For some people, rest is what's really needed. All right, if you can lay down and get some Z's in, awesome. That's what's going to help to reduce your inflammation. Eat lots of protein. For other people, there's no rest for their recovering. All right, so what I want you to do is follow these techniques that I'm going to lay out for you. The first thing that I would do to reduce any pain that I had after a total knee replacement is really just to get my hands on the knee. Because there's this tape or this lining over the incision, there's no real risk of infection, but of course washing hands. What I'm going to do is just rub over the area, kind of glide my fingers over it, my fingers and hands, right? And then I'm just going to add more and more pressure over time. And I can go to the side as well as the outside, my lower leg, right? Because there's going to be, the knee is going to be recovering down there as well. Sorry for that. You know what's really interesting is I see more women in pain than men. I'm curious of why you all think that might be. Anyway, another technique that I would use is using my hands just like this and kind of using my thumbs to push my kneecap down. Right, so this quad muscle, when it's contracting, it's going to straighten your knee or it's going to flex your hip, like to go into a sitting position. But right now, it's not really contracting. You're sitting, but not actively, right? You're just sitting up, right? But anyway, this quad muscle is going to pull at your kneecap. And when it does, it pulls up. When it pulls up, it puts pressure on your femur. So a lot of people, they have pain in the front of the knee when they go to bend the knee because they're pulling on the quad. So you can actually push down on that kneecap to get rid of that pain. Right, you can also use one of these guys. I'm using just ice. Right, put a paper cup, fill it up with water, put it in the freezer. And now I can kind of rub in the area where I actually feel discomfort. Because a lot of times it's not the whole knee, it's just a very specific area that needs a little ice, right? And kind of like what you did with the hands and desensitizing the area, you can, use the ice to sort of desensitize in the more specific areas, right? You can always use a Theragun. A little vibration helps to reduce the sensitivity of the quad. I wouldn't necessarily do this in a sitting position because again, the quad flexes the hip, so I am technically shortening the muscle. I would lie down though with my knee flexed if possible, like this. Yeah, lie down on the pillow. That's like the best position to get the most use out of this guy. Same thing goes for a heating pad. Not be in that same position. But if you need to sit up, of course, you could just throw the heating pad right over the top, right? And it's kind of like giving a muscle relaxer to just your quad, where it's going to allow that quad to stop pulling on the kneecap, making it a little easier for you to bend your knee, right? Having a little more mobility in your knee. All right. The other few things are going to be really distraction. Right, so if I'm focusing so much on my arms, when I go to put pressure on my leg, right, maybe I don't have to think about the knee as much, right? It might be so much anxiety surrounding the knee that you're focusing so much on every little bit of pain that's happening within the knee that your messaging between your brain and your knee kind of increases, sensitivity increases. So if you can just think about something else, that might help. That being said, A little diaphragmatic breathing helps, where you can kind of focus on the angle of your ribs and the way that they expand when you take a deep breath in and breathe out. So, you know, say from here, if I wanted to practice breathing from my chest, I would focus on pushing my chest out when I take that breath in and allowing the chest to collapse when I breathe out. Or I could do the same thing with my belly, where I breathe in and I'm pushing my belly out, pushing my belly into my hand, and I breathe out, pushing my belly in. Or I can do that with the ribs as well. I'm pushing those ribs out to the side and allowing them to come back together. All right, when I do this, I am working on my nervous system, right? Because the anxiety regarding everything surrounding this knee, I don't want this knee to hurt. I don't want to be in any pain. But again, if you can redirect your focus, you know, focusing on your breath, that can help to reduce the pain or your nerve sensitivity and what's happening to the knee. There's no amount of damage that you're going to do to your knee by moving it around, clapping it, or pushing this kneecap down. So you're safe. Again, if you have any questions, please leave a comment below, like, subscribe, and let me know what I can do for you on the next video. Thank you for watching.